Good morning, everyone. Welcome to the first grand rounds of the new year. I'm delighted to introduce our guest speaker this morning, Dr. Mark Tremblay. Before I do that, I'll begin with a land acknowledgement. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nations, Inuit, and Métis peoples and their valuable past, present, and future contributions to the community. I'm really delighted as our lead-off grand rounds of the new year to introduce Dr. Mark Tremblay. He's been a fixture at CHEO and CHEO-RI for many, many years. Dr. Tremblay is a senior scientist with the Healthy Active Living and Obesity Research Group, the HALO group at CHEO-RI, and a professor of pediatrics in the Faculty of Medicine. He's a fellow of the Canadian Society for Exercise Physiology, fellow of the American College of Sports Medicine, the Canadian Academy of Health Sciences, president of the Active Healthy Kids Global Alliance, founder of the Sedentary Behavior Research Network, president of Outdoor Play Canada, and an adjunct visiting professor at 5 other universities around the world. Dr. Tremblay has published more than 600 scientific papers and book chapters in the areas of childhood obesity, physical activity, measurement, exercise physiology, sedentary physiology, outdoor play, and health surveillance, and is often listed by Claire Barriott as one of their most cited researchers in the world in this area. Dr. Tremblay received an honorary doctorate from Nipissing University, has received the Queen Elizabeth II Diamond Jubilee Medal, the Lawson Foundation 60th Anniversary Award, and countless other awards for his research accomplishments. Dr. Tremblay's most productive work has resulted from his 36-year marriage to his wife, Helen, yielding 4 wonderful children. And before we started Grand Rounds this morning, Mark and I were talking about where his kids are. All have been very successful and have been sort of dispersed around the world. Today, he's going to talk to us about early childhood health and development, a look at the next 1,000 days. Mark.
Thank you, Jason. Supposed to that one there. All right. So we're good. All right. Well, good morning, everyone. Happy New Year to everyone. Hope 2025 is very generous to you. My presentation might be a little bit different than some of the grand rounds. This is, I'm presenting kind of a summary, so it's going to be fairly high level, of a project I worked on for the last 4 years with 5 other people from around the world who I'll introduce it in a minute. It really is a bit of a global health, population health perspective, but I hope there are a few lessons that you can pull into your clinical practice or at least your philosophy on things. So, and I'm really here to introduce to you a new term, I think, the next 1,000 days, which I will talk about. Arrow down should work, or no? Now arrow down works. Arrow forward. All righty, there we go. So these are the learning objectives that you should have received with the notice for the grand rounds. So I want to explain the next 1,000 days and explore why it matters for the health and development of young children. Anchoring it in a nurturing care framework, describe the global evidence on the importance and precedence of adequate biological, family, early childhood education environments, and climate change as well for early child development. Want to analyze new global evidence related to healthy movement behaviors in the next 1,000 days, and discuss the global costs of not investing in the next 1,000 days and the implications of the collective evidence for policy and practice. It's going to be fairly wide-ranging. Hopefully I can get through this before lunch. So this is really, the impetus for this was a series that we published in The Lancet just in November. The series was on early childhood development and the next 1,000 days. The series was led by a group of 6 of us with representation from South Africa, Switzerland, the United States, Canada, and Australia. And the series, in the end, was 2 papers, so not much of a series, to be perfectly honest. A bit of a sore point with me in particular. But anyways, the 2 papers in the series I will talk about first, but I will introduce a 3rd paper here as well. The first one's on the next 1,000 days, building on early investments for the health and really a paper on a series of reviews that were done to get a baseline of the evidence related to the next 1,000 days. And the second paper is the cost of not investing in the next 1,000 days. What is the opportunity lost by not paying attention to the next 1,000 days? When we were doing when we did the proposal to the Lancet, when it was approved, and for the first 2.5 years we were working on it, there were 3 papers. The third one that was focusing on and introducing the importance of 24-hour movement behavior, especially in the next 1,000 days. And after three rounds of reviews, and with the Lancet, you have 5 to 10 reviewers each time. The editor thought to withdraw that paper, that it wasn't sufficiently important. I will make little snide comments throughout the presentation why I think that was a very myopic decision, but that's the way it was. Nevertheless, we took that paper, which was quite mature. We'd been through three rounds of revisions already, and we split it in 2, and we've already published the one part of it in JAMA Pediatrics, pooled analysis of physical 33 countries. The other part of it, which is all the reviews that we had done, is slated for publication in the Lancet Global Health. So I'm not sure why this somehow is better for the Lancet, but anyways, that's the way it went. So I'm going to present 3 papers. This one only a few slides at the very end, and I'll be going fairly quickly. Ready. But I think this is particularly salient in the world that we live in. I was just chatting with people here about my general view of medicine is that it spends too much time looking in the rearview mirror and not enough time looking at the front windshield, looking forward for things. And in early childhood, we're still very focused on nutrition, which of course is important, but not singularly important, as the world has fewer and fewer kids that are stunted and malnourished, and more kids that are overnourished and overweight and obese. But on top of that, we know that there's less physical activity happening in the world, and that this is problematic for healthy growth and development. We know there's more screen time. This is a huge issue. Part of the whole creation of the Precision Child and Youth Mental Health Initiative, that's completely ignored in this series. It would have been brought in this paper that was cut. We know that we sit more than we ever have. We know that we sleep less, even little kids, than we used to. These are all problematic for healthy growth and development. And we spend less time outdoors also. So anyways, I'll try not to dwell on this, but it irks me. So anyways, we launched this series on November 19th, so this is pretty fresh. Later in the presentation, I have the link, and the slides are made available. Hopefully, if you're interested in this, you can see the launch of this. This was facilitated by the Early Childhood Development Action Network, and globally. So why should we do a series on the next 1,000 days? And so first, let's be sure we all understand the terminology that I'm talking about. So first, what's meant by the first 1,000 days? Hopefully that's a phrase that is quite familiar to people, established in 2010, the first 1,000 days. When we talk about the first 1,000 days, anybody? So it refers to the period from conception to the end of the 2nd year of life. So to when a child turns 2. It's not exactly 1,000 days, but it's pretty close to 1,000. And this was a big initiative that came out of a bunch of important research particularly on pregnant women, that showed the importance, particularly of nutritional elements for the mother while pregnant and in those first years of life, to set the kids on a healthy. Got to take that first 1,000 days window right from conception and start to pay attention to that to build a healthy trajectory for kids. And much has been done on this, much has been focused on this, much research has been done, policies developed, so on, and it's been very good. Like so many things, it doesn't end there. There's nothing magic when a kid has their second birthday. It's like, okay, well, we don't have to really pay attention to you anymore. We've set you on a good trajectory. Good luck. And you shake their hand and off they go. And not that that's exactly what was happening, but the research was very tilted towards the house. And of course, you know, the clinicians, when you're working with 2-year-olds, 3-year-olds, 4-year-olds, this is a pretty rapid developmental time where lots of things happen. And so we were trying to draw attention to that, to the next 1,000 days. So when kids are 2, 3, and 4, again, roughly 1,000 days, that this is absolutely critical for different reasons, but still a critical period. And this was driven a little bit and motivated. I showed you the 6 of us that were leading this. 3 of us were a part of the expert panel involved with the WHO for the creation of the global 24-hour movement. And that really was a bit of an impetus for this project. It was through the movement. This is when movement begins, when kids learn to be mobile and they develop gross motor skills and fine motor skills. They have some autonomy and so on. And so this next 1,000 days was particularly salient, particularly if that third paper had been part of the series. When you take it out, it becomes a little bit more generic, I think. But anyways, that's what we mean by the next 1,000 days, from when a kid turns 2 to when they turn 5, okay? Those 3 years. In the next 1,000 days, children, of course, you know this, gain autonomy. They develop massively in all different ways. They transition from primary oversight in the health system, where they're going for their immunization shots, they're seeing their pediatrician or their doctor on a pretty regular basis, or public health nurse and so on. But that shifts after they turn 2 rather substantially to care being provided predominantly by early childhood care and education. So it's a different mechanism that we need to be aware of from a global perspective. We wanted to draw attention to the next 1,000 days as a critical stage of the life course, building on the investments of the first 1,000. A lot of territorialism as we were doing this. It's like you're saying, oh, this is more important than the first 1,000 days. And it's like, no, that's not the case. But the first 1,000 days aren't singularly important. And so we did these 2 papers, building on early investments and the cost of investing. So I'm going to go through these 2 papers and then at the end talk a little bit about the other paper that only got published in Pediatric. This is building on early investments for the health and development of young children. So why do the next 1,000 days matter? Well, it's a period of significant growth of skills, holistically skills. It's a sensitive window of opportunity to mitigate environmental risks, promote protective factors, and establish healthy developmental and behavioral trajectories. So we want to minimize the bad and maximize the good during this period. And it's a chance to sustain and build on all of the efforts we made in the first 1,000 days and recalibrate trajectories where we haven't done so well. And again, try and think about this globally, not just locally, or locally, but with your patients who are new immigrants that have come from maybe low and middle income countries. And so this is all anchored in the nurturing care framework. You probably can't, I can barely see this, but this is the figure that we used in the diagram, that we modified the nurturing care framework, which has been applied almost exclusively to the first 1,000 days. We developed it for the next 1,000 days. Okay, and it's anchored in these 5 dimensions. The arrow here: security and safety, responsive caregiving, health, nutrition, and early learning. This was the original nurturing care framework. We've taken the focuses from a first 1,000 days focus to a next 1,000 days focus. So if you actually read the stuff that's in here, it's slightly different than in the first 1,000 days. And we do this to try and optimize key developmental outcomes in the next 1,000 days, including school readiness, social emotional development, numeracy, self-regulation, motor development, language and literacy, cognitive development. Okay. And these 5 dimensions are supported by policies in different jurisdictions. For example, child protection policies, parental leave policies, social welfare and financial support, environmental protection, and so on. That's the outer circle this. Again, hopefully these slides will be available to you if you're interested. Also available in the manuscripts that are published and open access. And we did this to align and extend the nurturing care framework, which had been focused on the first 1,000 days. It's meant to represent the fact that it's a comprehensive, multi-sectoral, multi-level life course perspective, and that enabling environments and enabling development are cumulative and continuous. So we need to, all the efforts we put in the first 1,000 days, if we don't have some continuous effort in that regard, they'll be lost. Also provides an opportunity for those that didn't get what they needed in those first 1,000 days to be rehabilitated in the next 1,000 days. And so in the paper we focused, and so these are all based on multiple systematic and scoping reviews, but focused on 4 environments: the biological environment, the family environment, the ECCE environment, and climate change. The focus is on low and middle income countries here because that's the burden to the world, really, disproportionately. So I'll focus a little bit more on that. In terms of biological environments, it's estimated that about 53 million children less than 5 years of age have developmental difficulties with limited evidence of effective early intervention strategies in low and middle income countries. And they have poorer health, they have reduced access to health, education, and protection services, they have higher risk of trauma, abuse, and neglect. So that's a particular target area that needs to be focused. And in the areas that it needs to be focused the most is the areas of the world where it's focused the least. There are micronutrient deficiencies, anemia, undernutrition that persist in this age group. But while an increase in overweight and obesity, particularly in some areas of the world, are rapidly increasing, we're actually making headway in reducing issues related to micronutrient deficiencies, underweight, and so on. And we're losing the battle rapidly on overweight and obesity, which again requires us to look through the front window and to project out what the new issues need to be for a nurturing care framework. And that certainly includes 20 behaviors: healthy sleep, healthy movement, healthy screen use. Okay, family environments. The quality of home stimulation, caregiving behaviors, cognitive skills, caregiving knowledge contribute to child outcomes over and above the indices of economic advantage. So it's not just your family socioeconomic status, but it's the characteristics of the caregivers that contribute to the well-being and the nurturing care framework for the child. Fewer evaluated parenting interventions happen in the next 1,000 days because the focus has been on the first 1,000 days. That's where the research has gone. That's what we understand. Focus is almost predominantly on the mother, very little information on the father, whose role globally is much smaller in the first 1,000 days. We need to understand the next 1,000 days where these transitions happen. Transitions from healthcare to early childhood education care, from mother to father, from complete oversight to a little bit of autonomy. And more evidence is needed on interventions promoting caregiver mental health as well, which seems to be completely ignored and is an evolving problem. I think we're well aware of that here at CHEO. Parents play an important role in supporting successful transitions to early childhood care and education. Parenting interventions integrated with ECCE may be beneficial, although there's very limited evidence from low and middle income countries. If you did a systematic review of interventions in this time, you would find maybe 300 papers, of which more than 200 are from the US. Very, very heavily tilted, not just to high income countries, but to the United States in particular. In terms of ECCE environments, access and equity to quality care and early learning outside of the home matter. About half of the kids around the world are enrolled in ECCE programs. That was pre-COVID when the data we had was available. There's benefits to children's developmental outcomes when participating in ECCE programs. Most of the research has focused on cognitive outcomes, and there's a need to look at more psychosocial and physical outcomes as well. There are larger effects, larger beneficial effects for more disadvantaged children by having access to early childhood care and education. So those that need it the most benefit the greatest. There's no gender inequity based on the literature, which is a wonderful thing that ECCE seems to remove that. However, the research in this area doesn't pay much attention to quality. And so this is where some of the noise is introduced. Programs with no attention to fidelity or intervention or quality. You'll see some that don't seem to provide any benefit, probably because it wasn't implemented well, and others that show tremendous benefit because it was. And then finally, pollution and climate change. More studies are needed, especially in low and middle income countries, on pollution and climate crisis. Air pollution is associated with delays in psychomotor communication and socio-emotional development. Secondhand smoke is a problem, not just from cigarette smoking, but in much of the low and middle income countries, in-home fire, coal burning, and so on is a reality. And so the in-home air quality is very bad, and it's associated with consequences, of course. Water pollution is an issue, and in general, sanitation and related issues is a problem around the world and affects the trajectory that children will be on. And exposure to chemicals and heavy metal pollution, which, you know, we've done half decent job of getting rid of here in Canada, but in the rest of the world, not so. And even looking at things like pesticides, still here, even in Canada, we find reasons why they're okay, so that you can spray a golf course so that it won't have any weeds on it. The animals and the plants and the people around it should be okay. More of a, not the focus of this, but more of a One Health approach needed in general around the world. So key implications of the review findings. So those were all based on a whole bunch of reviews that were all published separately. We need to package multiple nurturing care inputs to mitigate risk and promote protection, and further evidence on effectiveness is needed. We need to strengthen multi-sectoral partnerships across health and nutrition, education, child protection, and social protection and welfare, with particular attention to early childhood care and education settings. Note this doesn't talk about movement behaviors at all, because that wasn't part of the series, but I would have added that to this list. We need dose and quality of service provisions to strengthen protective environments. And we need to assess program progress, equity, and inclusion around the world. A lot of this, I didn't mention at the beginning, is driven by the meeting of the United Nations Sustainable Development Goals, particularly Sustainable Development 4.2, which says that we want all children, boys and girls around the world, to have access to early childhood care and education, quality early childhood care and education. And the actual target metric is 1 year of exposure, and I'll explain why that's important in the next paper. Now, in this first paper as well, we estimated young children's access to nurturing care and development in the next 1,000 days. So what proportion of kids around the world actually achieve nurturing care within that nurturing care framework, that really busy circle I showed earlier? And only 1 in 4 children in low and middle income countries receive adequate nurturing care. So their trajectory for success, emotionally, cognitively, psychosocially, physically, is already mitigated early on. You can see the different proportions here. So these are all framed in the positive. So 86% have a healthy body weight. But if we go to the 3 things, the 3 bars to the right, less than a third are experiencing no physical punishment, are experiencing adequate stimulation from non-maternal caregiver, and participate in early childhood education. So 2/3 of the kids in low and middle income countries are not getting these very basic nurturing care characteristics. This is showing the proportion of kids receiving adequate care on a global level. The countries that are white are high income countries and so aren't included here. Pay attention to where they are for future graphs, future maps that I'm going to show. But basically, we show that the poorest areas of the world, the low and middle income countries, the sub-Saharan Africa, South Asia areas, have virtually no kids receiving adequate care. Much more in more developed countries. The work from the Save the Children's International Development and Early Learning Assessment Program, this is 3 to 7 year olds, done in low and middle income countries, shows that children who have received learning support and responsive care are approximately 2 years ahead in their development. It's a massive, massive difference. And you see the line here, so you get this added. So it doesn't really matter what indicator you're looking at, whether it's motor, literacy, numeracy, social, emotional. They all follow the same trajectory. And so they're at a disadvantage if there's no early learning or responsive care available to them. Just a line of identity there. Okay. But as soon as you add early childhood care and education, it brings them up to an even playing field. If you add to that learning materials in the home, if you add to that other things, stimulation in the home, access to games, attention of the caregiver, safe places to play, and so on, you get this continuing upsloping line. Okay, fairly simple things, and in our culture may seem fairly rudimentary, but globally still don't exist, which is why we still are nowhere near the United Nations Sustainable Development Goals. Now, if we look, we also looked at, okay, so what early childhood care and education interventions exist? Where are they? And so contrast this map to the one that you saw earlier where the need was greatest. Of course, this is always the case, right? It's the exact contrast where most of the things are happening. And I mentioned that greater than 200 interventions published and available in the United States, less so around the world, but really clustered to the high-income countries. Almost nothing available to those that need it most. So in terms of intervention recommendations, there are a number of gaps. There are gaps on parenting interventions in the next 1,000 days. Lots of parenting studies on the first 1,000 days, and then it seems to stop. Parenting role is very important in the next 1,000 days, and transitions in many cultures, at least somewhat, from mother or care provider to father, especially when it comes to movement and play and so on. It's the dads in many cultures that will stereotypically go and do some rough and tumble play with their kids and take them outside and teach them to hunt or whatever the case may be. Family mental health is almost completely ignored and is certainly overtaking physical health issues as the greatest challenge. Violence prevention and nutrition in the next 1,000 days, also underrepresented in the literature. ECCE settings offer a protective environment for promoting development. We need to shift the positioning of interventions from within health platforms in the first 1,000 days to ECCEs in the next 1,000 days. And I honestly don't know how much we do this in Canada and use the ECCE system as an opportunity for mass immunizations, for nutrition counseling, for healthy movement development counseling, and so on. But that transition needs to happen. We need to shift the stakeholders from the health to the education sector, and of course, work together in that regard. And recognize this transition in our systems and their interventions from the first 1,000 days to the next 1,000 days. So to conclude on paper one, development in the next 1,000 days is important, and it's different than the first 1,000 days. It's multidimensional, it's cumulative and continuous, and it adheres to a life course perspective. And it doesn't end, of course, at the next 1,000 days, because then the next transition is going to school, right? So 20 years from now, maybe someone will be presenting on the next 1,000 days. More evidence is needed on environments influencing the development in the next 1,000 days, disaggregation of findings salient to the next 1,000 days, not focusing on what the first 1,000 days focused on, which were different development, 0 to 2, and focusing on the ones that matter, the milestones that matter in the next 1,000 days. We need more research on low and middle income countries, their vulnerabilities to climate change, to migration, and the challenges that the globe is facing right now. We need to leverage partnerships across platforms, and health needs to work with education and early childhood development workers more so on a global level. Okay, so that was paper one, setting the stage. Paper two is then, okay, so there's quite a bit of evidence to suggest that really, particular on a global level, really beneficial to developmental trajectories for kids. So what is the cost of not paying attention to that? And so this paper builds on the global efforts and key milestones that have happened over the last 10 years or so. There's been significant growth in early childhood development initiatives globally, including the 2015 Sustainable Development Goals that people should be familiar with. They're driving policy around the world. The 2016 Early Childhood Development and Action Network, which is who we did the launch presentation with. In 2018, the Nurturing Care Framework came out, focused on the first 1,000 days, and we've adapted it for the next 1,000 days. And the G20 committed to early childhood development and a focus on that in 2018 as well. There's an emphasis on nurturing care for growth and development in the first 1,000 days. And there have been previous series, and we acknowledge that in the Lancet series, 2007, 2011, 2017, that focused on these early years, but not specifically on the next 1,000 days. And they were very tilted to the first 1,000 days, as the focus was at the time. We reviewed evidence on effective interventions in the next 1,000 days, including the impact on early childhood care and education on short and long outcomes. So this is mathematical. This paper highlights universal access to at least 1 year of ECCE, which is the target for Sustainable Development Goal 4.2. So we anchored to that and said, okay, what if we could provide for kids around the world just what the Sustainable Development Goal has? What would be the cost, and what would be the cost of inaction for that? And we provide recommendations based on findings from the series, the two papers. So we needed to establish what works for child development in the next 1,000 days. And so we looked at effectiveness studies and found that they primarily focus on a few things. Cash transfers are done in the Caribbean and South America a lot. Early childhood care and education, which will be more the focus here. Nutritional interventions, parent interventions, and multi-component approaches. It was a comprehensive review. We found 100 studies that had 951 impact estimates across the globe, highlighting patterns related to the intervention. So the results in a minute. We provide estimates of the association between early childhood education and care and long-term outcomes as well from data like the PISA study and others. Okay, so here, what works? So let me orient you first to this graph. So this is the average effect in standard deviation units, okay, 0 line there. So just looking at this, almost everything is a positive effect, whether it relates to health, social emotional measures, cognitive measures, schooling, and adult measures. And then down here, we have all and pooled for the different categories, and then different parts of the world. So if you want to tease it out, you can. But in general, the story here is very positive, that the interventions work on a global level. There's strong potential for impacts on children's development. The positive impacts exist across the world. So if you look at the different areas, you can still see all the lines are above 0. Across multiple child developmental domains, they work. Now, this is the same sort of graph, only now we've organized it by the type of intervention: cash transfer, ECCE, nutrition, parent education, multi-component. Okay, so same information, organized differently. And you can see then across the different geographic regions. Again, predominantly on the positive side for everything. For cash transfers, there's moderate effects, 0.13 standard deviations. For nutritional programs, roughly the same thing. So largest in Latin America and Caribbean countries, and best for conditional cash transfers that require the recipient to do something, not just get money. Similar for nutritional programs, large for ECCE programs, large for parenting programs, bit mixed for multi-component programs, where I note as well the fidelity of the program and the implementation varies rather substantially around the world, depending on where the program was implemented. So in terms of longer term effects on ECC, so if you're exposed to early childhood care and education, does that have any impact later in life? Is there any evidence of that? And so we were able to get that information from the PISA study, which some of you might be familiar with. Mostly high-income countries, but lots of them, and has information on whether kids attended ECCE and then how they're doing in the PISA study later on. And we controlled for a whole bunch of variables that you would expect us to control for. And in general, you can see that children with at least 1 year of ECCE, consistent with UN Sustainable Development Goal 4.2, had higher scores for mathematics and for reading. Okay, so this is the 1 year here. And so you're seeing these sorts of levels of effects. About 40% of the difference between a high-income country and a low-income country deficit. And the differences improve with the longer exposure to ECCE. So pretty compelling, from early childhood exposure to performance in high school. Additional evidence comes from the Young Lives study, which follows children in low and middle income countries from Ethiopia, India, Peru, and Vietnam. Rich data allow looking at academic and behavioral outcomes, which may shape the outcomes of children in the long run. So similar sort of prospective look at things. We focused on math and reading scores, as well as consumption of alcohol. They don't measure. And again, you're seeing the same story here, a positive effect in all areas, in all indices for the most part. Children exposed to ECCE had very similar standard deviation increase in math scores at age 15 that were sustained at age 19. These are measured repeatedly. You see almost the exact same pattern here with verbal scores, improved at age 15 when the exposure was in like age 3 and 4, and maintained at age 19, making these people more employable, increasing their odds, their trajectory. And when we look at health behaviors, at least as exposed to alcohol consumption, 6 percentage point improvement to consume alcohol at ages 15 and 21. So that's quite substantial on a population level, even higher in Ethiopia, where the problem is quite evident. So behaviorally, cognitively, academically, improvements later on in life when exposure to early childhood care and education happens. Good investment. We also teased out the longitudinal studies from the review that I spoke to at the beginning, looking at cognitive skills, social emotional skills, executive function, where there's longitudinal evidence. And it suggests that early life cognitive skills are most predictive of adolescent school achievement. So if you can get kids' cognitive development on the right track early on, it will track. Same, less so for social emotional skills and executive function. So the current global ECCE participation rates for kids in the next 1,000 days is shown here in the map. You can see fair bit of global variance. There are many places in the world, Russia, Australia, Brazil, where virtually all kids use ECCE services. Canada is notable in being lower, in fact, than many of the other countries, but almost a complete absence in the area of the world that needs it the most, the clustering of low and middle income countries. Yeah, So this consistent pattern that we have things where we need it the least, we don't have things where we need it the most. 54%, I mentioned this earlier, of pre-primary school age children attend ECCs globally. More than 80% in most high-income countries, less than 20% in most low-income countries. Huge inequities. The green. Oh, yeah, it looks gray on mine. Yeah, so that would correspond to 60 to 79. Yeah, so most kids, like in most high-income countries, have access to and use early childhood care and education services outside the home. Okay. So what would this cost then to try and improve this? Well, we estimated that providing universal access to ECC would cost on average $337 per child per year in low and middle income countries. At the national level, the resulting cost would correspond to less than 0.1% of the GDP in high income countries and 0.5% of GDP in low income settings. See the results there, and this column over here. Just look at these numbers, less than 1%, because I'm going to talk, this is the cost. The next few slides, I'm talking about the cost of inaction. Okay, so kind of the inverse of that. So for this, we made some assumptions, and yeah, I won't go into the detail. The papers are there if you want to know all the math. Mostly conservative estimates and assumptions were made. So if anything, our results are probably conservative. And so this is the global distribution organized by World Bank income levels, so high, upper middle, lower middle, and low. And the estimated cost of inaction relative to GDP is listed here. Okay, and so this would be the median for the low, and this would be the mean for high income countries. Okay, it varies quite a bit because the number of children currently enrolled is very high in high income countries, very low in low income countries. There's different cost of provision, there's different age of labor market entry, and things that we needed to consider in the calculations. But look at this for low income countries, 6.8% cost of inaction. Remember from the previous table, the cost of implementation is in the 0.1 to 0.4 range across countries. So you get your return of investment of between 8 and 20 times. So key messages from the series. The next 1,000 days are a key period for children's development. Robust and rapid growing evidence highlight short and long-term benefits of interventions specific to the next 1,000 days. High-quality ECCE programs can improve short-term and long-term cognitive and academic outcomes. Parental education, cash transfers, and nutritional programs can also contribute positively to childhood outcomes, but it seems like early childhood education focus is a good buy. They serve as a key platform for the promotion of healthy behaviors, growth, and developmental monitoring, as well as nutritional supplementation, as well as educational transfer. Could also possibly be immunization implementation, other things. Access to ECCE remains low globally, particularly in low-income countries. Providing 1 year of ECCE, so the target for Sustainable Development Goal 4.2, costs an average of less than 1% GDP. It's financially doable. Yet the benefits are 8 to 19 times greater. It's a pretty good investment if we could do it. Investment in children in the next 1,000 days can help countries achieve the ambitious Sustainable Development Goal targets for health, for education, for equity, complementing investments that have been done since 2010 in the first 1,000 days. I'd like to acknowledge the people that were involved with the series and made it happen. And then, as I promised, there's the links to resources. If you want the actual papers or want to view the launch seminar, we have an article in the conversation and other things. They're there. So I'm not sure if these get posted in a way that people can access, but that's there. So then just a couple, 3 slides on a paper that got kicked out and that we published in JAMA Pediatrics. So a global analysis of meeting physical activity, sedentary behavior, and sleep recommendations of preschool-aged children, and a fellow that's working with us at the University of Wollongong presented this in Paris a couple months ago. So I'm stealing his slides with his permission. So the question that we had was, what is the global proportion of 3 and 4-year-old kids in the next 1,000 days who meet the World Health Organization guidelines for movement behaviors, physical activity, sedentary behavior, sleep? And so these are based on WHO guidelines that I was a part of developing that recommend that kids in the next 1,000 days accumulate 180 minutes of total physical activity, at least 180 minutes of total physical activity per day, of which 60 minutes is moderate to vigorous physical activity or energetic play, that they do not accumulate more than 60 minutes of screen time per day, and that they get good quality sleep of 10 to 13 hours. And the reason for this paper was there's a lack of information on low and middle income countries, and huge methodological variations. If you scan this literature, which we did, these were both postdocs of mine, so this is all based on systematic reviews out of my lab, that there's massive methodological variations. And so we wanted to actually bring all of the information in-house so we could analyze it consistently and meta-analyze it. So that's what we did. We pooled data from 14 studies, around 7,000 little kids from 33 countries, including 20 low and middle income countries across all geographic regions of the world. And this is what we found. And so, so in general, you can just see that they're low levels. So most kids are not meeting very basic movement behavior guidelines. Just sleep right, don't watch too much screens, and move a little bit, 3 hours a day. And so overall, that's 14 across the world, across these 33 countries, 14%. If we look at it stratified by country income, not a huge difference. This is a problem across the world. And then finally, if we look at different geographic regions, we do see a fair bit of difference. So the difference between North and South America, so we hold the basement values here, are about 3 times lower than those in Africa. Okay, Africa very rapidly increasing screen time, decreasing physical activity. And so again, stop looking in the rearview mirror and start looking out the front of the windshield to where problems are and the importance of 24-hour movement behaviors for the future health and development of kids in the next 1,000 days.
Ouais, non, mais... Tu vois, plein de produits, pile pour 3 mois, comme ça, je les prends pas dans la valise. Bah oui, mais moi, le donne douche, si je le finis pas, je le laisse. Ah oui, moi aussi, je vais jamais reprendre. Mais de toute façon, je pense que j'ai le douche, ça.
Okay, sorry, Alex. What I'm saying here is the proportion meeting 24-hour movement guidelines in Africa is 3 times what it is in North America. So from a movement perspective, they're where we should aim to be. Yeah, but we didn't pay attention to that in the Lancet series. Okay, so the universally low compliance highlights a global issue of triple impact relating to policy collaboration. So we need to advocate for policies and interventions promoting 24-hour movement behaviors that are tailored to the cultural and contextual realities of different populations, which are very different. The challenges for healthy sleep and screen time and so on vary around the world. All stakeholders, that is parents, educators, policymakers, communities, must work collaboratively to provide environments that encourage healthy behaviors in children. And more data from nationally representative samples, especially from low and middle income countries, using standardized measurement protocols needed. This is a little bit self-serving because I'm the executive of the Sunrise Global Study where we're doing exactly that. That came right out of the World Health Organization guideline development. And we're now in close to 70 countries doing standardized measurements on kids in the next 1,000 days on 24-hour movement behaviors and correlates related to them. Thank you very much for your attention.
Thank you very much, Mark. It was really fascinating and truly impressive, the global impact of your work. So we do have some questions. General sort of the development that that
Is there an example where
one can actually see transition?
It's a good question and a common question, and you know, because we're always looking for, you know, is there a model that we can go from? And we do this with the Active Healthy Kids Global Alliance Global Matrix, where we compare across countries. That's more with school-age kids. But in general, we find that Scandinavian countries have it figured out better than most other countries, which is an interesting thing because when I'm in think tanks and talking to government people and so on, unhealthy movement behaviors in Canada and so on, climate and so on, Finland and Sweden. So they have very strong social programs. They have very strong care for families in the early years. They have very strong policies and cultural norms related to habitual physical activity. Now, they don't have it all figured out, you know, but I would say in general, if we're going to try and emulate, there are those that we would do this with. It's interesting that in Canada, as it relates to early childhood care and education, that half or less than half of the kids in our country go kind of, at least reported, to go to those sort of formal structures, which is less than our peer countries around. And so I wouldn't argue whether that's good or bad, given the other conditions that we have in Canada. But it's interesting that compared to most European countries, Australia, the United States, we have far less participation in organized ECCE programs in Canada.
Thanks so much. And we will repeat the questions if you come and look at that question from Alex around the example successful globally. Toby.
Thank you.
We're worried that we're thinking about transition, adjusting supports for the first 1,000 days of support, and we also need to build parenting capacity. There's, you know, nothing wrong with a mom in Ethiopia or Peru. It's more the things that they're facing that are allowing them to not have an enriched environment. So, housing insecurity, which would be similar for low income countries in Canada, where it's hard to parent effectively when your basic human needs are not being met, right?
Yeah.
And so the data from Scandinavian countries promoted that actually extended and longer parental leave.
That's right.
Then an impact on attachment and early childhood mental health. So how would you sort of recommend, if you were sort of thinking what would be the optimal intervention between, like, CCE can mean a lot of things, but what level versus what level do we need to look at making sure that parents are supported in the other half of the day where the kids are in home environment, especially situations parents are dealing with major struggles or single parenting.
Yeah. So the question was pursuant to the comments about Scandinavia, which are specific to that culture and so on. How would that translate to others? What's kind of the optimal balance of things and achievable perhaps in low and middle income countries? And so, you know, as you mentioned, it's very context dependent. You know, it's not feasible to give 2 years of mat leave in Peru or in Kenya, you know, fully covered and then move into a strong ECCE program. I think so. There isn't one size fits all, but what is clear is that regardless of the environment, that if we could get 1 year exposure of VCCE to all kids, boys and girls, that the trajectory would be massively improved. And so that might be an earlier exposure in certain countries. It might be, in the case of Scandinavia, a later exposure, because usually it's 2 full years that mom or dad are home with the child, and then they go into a robust ECCE program. That's very, very high income countries with lots of resources. But in some of the other countries, that probably wouldn't be feasible. We did do a little bit of sensitivity analysis, and yeah, there's different trade-offs for intervening earlier on. So if you did have 1 year of VCCE, would you want it at age 2, at age 3, at age 4, at age 5? And there are gives and takes both ways. Probably also culturally dependent, and maybe even specific family dependent, that, you know, for you, the 2-year-old, because of whatever struggles are going on in your life, that would be the best time for it. Whereas for you, a 4-year-old, because of whatever support systems you have and so on. So it's probably not a one size fits all, but that the investment at a country level is definitely worth it. You're getting huge on your investment. But we've got to look upstream. Like, this is a problem we still struggle with in Canada here too. We, as much as we talk about being upstream, we invest downstream. It's always the crisis of the day, always the crisis of the day that we're dealing with. And we never actually get the opportunity to put in full efforts on prevention mode, that we won't feel the benefits for a generation, but we will feel them, and we never will if we don't do that. For sure. Sure.
Thank you very much.
Yeah. Yeah, so the question is well, there was support for the third paper that should probably have been in the series, and the question was, is there a need for a fourth paper focusing on nutrition and the changes in nutrition, ultra processed food, and yeah, it's cheaper to buy Coca-Cola than it is to buy milk and those sorts of things. A little bit of that is captured in paper number 1. I didn't go into it in a lot of detail. And a fair bit of it has been captured in other series in the land. So I don't know that for this series, it would be captured, and how unique it probably, like, there's probably some merit in the next 1,000 days as kids get exposed to sugary cereals and sugary drinks and these sorts of things, that there may be some merit in doing that. But for sure, the environment is set in the opposite direction of what I'm advocating for here. A healthy trajectory. We've got ultra processed food. We've got big business, big food that are very effective at getting their stuff in front of kids, and it tastes good. And we all suffer from it. And we're compromising the other side of the energy equation by spending more time indoors, sitting more, on screens more, moving less outdoor time. Like, these are trends that are clear around the world, and climate change is worsening, because of severe weather events, and so more and more it's unsafe to be outside. Interestingly, healthy movement behavior habits can actually help to mitigate climate change in a small way by doing that. So all those reasons were frustrations for having that third paper, which I think would have solidified the series a little bit more. But anyways, I think we're out of time.
And this importance of movement to all of you that are here. Don't first you walk the car in the -15 weather today when you came in, or when you leave today.
or bike or whatever whatever means you came in today. You know, I want to take this opportunity to congratulate Mark and his team on these outstanding papers and and for presenting at Grand Rounds. What a great way to lead off the year. So thanks very much, Mark. Please fill out the survey. It's been put in the chat, and have a wonderful day. Thank you.